Hi, I'm Ryan Nutter with Cornerstone Senior Advisors, and in this video I'm going to discuss with you 5 common Medicare mistakes that people make. The first one being they don't review their policies. You should review your policies on at least an annual basis because each of these policies can change. If you have a Medicare supplement plan, your price is going to go up. So just to make sure that you're not paying too much for a policy that you can get cheaper elsewhere, you need to review that policy each year. Your prescription drug coverage, those drug plans are going to change each year. And so whether that be the premium, the network of pharmacies they work with, how well they cover your medications, all of those things can change. And your Medicare Advantage plans, those plans are moving targets. So the best plan option for you this year may not be the best plan option for you next year because they can change their max out-of-pockets, their deductibles, their co-pays for specialists, primary care doctors, and things like that. Whatever policy you have with Medicare, you need to review that policy each year just to ensure you're in the right product on the right policy for the right price. Number 2, you need to make sure you're working with an independent advisor. And what I mean by independent is you're not tied to one company. If you're working with a captive agent, that means they can only offer one product, one company's product and their one company's product offerings. They can't shop for the best price. They can't shop for the different products that all these companies offer. As an independent, and we're independent at Cornerstone Senior Advisors, we can look at every company's product offerings. We can pull from each company and what they offer, and we can make sure you get a plan to fit your needs and make sure that you're paying the most affordable price that we can find for that product. So number 1, you need to review your policies each year. And number 2, make sure you're working with an independent advisor. Number 3, do not enroll in Part B of Medicare too early. So what I mean by this is oftentimes someone turns 65, they're eligible for Medicare, but they're still working and they're still employed and they have group health insurance through their employer. If you're going to stay on that group health insurance plan, because it's considered creditable coverage with Medicare, then you don't need to sign up for Part B of Medicare. There's no sense in paying Part B, which comes with a monthly premium, when you already have a group health insurance plan through your employer. Now, when you reach within 3 months of your retirement date, that's when I always tell people I'd like to sit down with you and begin the Medicare process, and enrolling in Part B and picking your supplemental insurance is 3 months in advance of that retirement date. But there's no sense in enrolling in Part B if you're going to continue to work. If your employer coverage, health insurance through your employer, is considered creditable coverage, then you need to delay Part B of Medicare and not pay that added monthly premium until you're ready to retire. Number 4, you need to sign up with a prescription drug plan. So oftentimes someone's going on Medicare and maybe they don't take much for medications or they don't take any medications, so they don't feel like they actually need a prescription drug plan with Medicare. And in that situation, I always advise someone to sign up for a prescription drug plan, because if you don't sign up now and say 10 years from now you're taking several medications, one of them's name brand, and you actually want some help with that prescription drug medication, and so you sign up with a prescription drug plan, you're going to be penalized for every month you were eligible for that prescription drug plan and you didn't sign up for one. So even in the beginning, if you're not taking much for medication, sign up for a prescription drug plan just to avoid being penalized down the road, because that penalty gets pretty big and it doesn't go away. It's an added penalty you have to pay on top of your monthly premium for your drug plan every month for the rest of your life. So number 4 is don't delay signing up for a drug plan. When you go on Medicare, make sure you get a prescription drug plan. And number 5 is to look into ancillary products. There are several things that Medicare does not cover that typically people want to find coverage for. Medicare does not cover dental or vision or hearing. A lot of people want to look into hospital benefit plans or cancer plans. All of these types of policies are things that just give you added coverage on Medicare and can be a blessing for you in case of a health event or a life situation arises. So look into these ancillary products, dental, vision, hearing plans, just to make sure if you want that coverage. Well, there's a lot of policies out there that may fit really well with what you're looking for. So these are the 5 common mistakes that people make on Medicare. At Cornerstone Senior Advisors, we review your policy each year. This is not a one and done opportunity to work with us. If you choose to work with us, we're going to contact you and be in touch with you each year to make sure you're in the right product that fits your needs each year at the right price. If you would like help and assistance with these ancillary products, with making sure you're on the right plan and have the right coverage, please call us today, 316-260-3331. We'd be more than happy to help.